All righty. You want me just to get started?
Yeah, let's do it.
Okay. All right. Well, hello, everybody, and welcome to Crashing the Biofilm Party. We're going today to understand the path of safe dental unit water lines. And a little disclaimer first, I am sponsored by ProEdge Dental Water Labs, so I work as a key opinion leader for them because I truly believe in their products and their company. So a little more on them at the end of this presentation. But a little bit about me, I am a dental hygienist. I started out as a dental assistant back when I was in high school, and then progressed into hygiene school and have been a hygienist for almost 30 years now. I live in the Norfolk, Virginia area, so Virginia Beach. So if you're ever in my area, please look me up because I'd be happy to show you around. And I'm the member of lots of organizations. And back in 2022, I won the Emerging Infection Control Leader Award from the Association for Dental Safety. And the Association for Dental Safety, guys, I got to tell you, if you become like your infection control coordinator, is an awesome organization to join, have your office pay for your membership, and it will really give you those resources you need to be really good at infection prevention. So let's talk a little bit about water. Guys, I got to tell you, I had been a hygienist for like 22 years before I had ever heard of having to do something with dental unit water lines. Like I hadn't heard anything. The only thing I'd heard is I heard in hygiene school one time a professor told us that we needed to run our lines every morning because one time she had a spider crawl out of her power scaling line. So I thought that we ran lines in the morning and in between patients because of spiders. It had nothing to do with biofilm. Well, now I know. I listened to that lecture that one time and I ran into my office. Well, I went in the next day. And I was like, hey, are we testing our water? And they're like, no, we're not testing our water. And I was like, whoa, we got to start this, guys, because I want to make sure that the water that's going into, this is a picture of my daughter's mouth. I want to know that the water that's going into my mom's mouth, into my mouth, into all of our patients' mouths is safe. And so that's when I started my waterline journey. Now, I will tell you, this journey is not a one and done. I am still learning because sometimes we still fail waterline tests because biofilm is a beast. So today we are going to be talking about water lines. And as we look at the picture of this operatory, it's like so pretty. It's so pretty and white. And all the lines are straight and nothing is crisscrossed and it is beautiful. But I got to tell you, when you get into private practice, this is probably not what your op's going to look like. It's going to look way more like this. And so these lines get tangled up. You'll go to pick up the air water syringe and the suction will fall on the floor. And so these lines get tangled up in our ops and they get tangled up in our heads. Today, we are only talking about water lines. Those are the lines that squirt water into your patient's mouth. That could be an air water syringe, that could be a handpiece, that could be a power scaler. We're not talking about suction lines. Those are the ones that take water out of our patient's mouth. That's a whole nother lecture. Happy to come back and talk about that another day. But to keep this fun and interactive, we're going to play the safety game while we do this. So the safety game means that you're going to vote. You're going to vote green, good to go. You think that this sample is safe. You're going to vote yellow, maybe it's kind of in between, not quite a fail yet, but man, it's time to shock. Or red, epic fail. Okay, so I want you guys to think about this. So this is my pedicure water. So I leaned down in the middle of a pedicure, scooped up a water sample and tested that water. What do you guys think? Do you guys think it was green? Do you think it was yellow? Or do you think it was red? Epic fail.
Red.
Oh, I hear a loud red. You are totally right. It is epically red. Oh my, there we go. Total red. Like, oh my gosh, so bad. So don't shave your legs before you go for a pedicure so you don't get a staph infection. Now, good news, I talked to my pedicure place about the epic fail and then they put a liner in. So do you think with a liner, do you think now the line's passed? Do you think it's a red, yellow, or green? What do you guys think?
Red.
Total green. So moral of the story is if you go get a pedicure, go someplace that has liners. So otherwise, if it's totally red with a liner, maybe that's your own foot fungus. So who knows? All right, so let's talk about water. Why are we testing water? There is biofilm that grows in those little dental unit water lines. That affects our patient's health, that affects our health, And the CDC, the FDA, the ADA, a whole slew of organizations say that we have to do this. So this is something that we have to do. The reason that that biofilm grows in those lines, you're like, dude, I didn't put the biofilm there. Of course not. But the reason it grows is it's because there's tiny tubing. And if you ever take off like your air water syringe to see, like some of that tubing is so small, you can only fit a paper clip in it. It's so skinny. Because of that low flow water, and because the water, it's so tiny, all the water is able to touch the inside of the tubing. It's able to lay down biofilm, and it's really able to form. And if you look at this green picture, the green tubing, the tubing was green, but the inside of it was not yellow. The inside of it was filled with biofilm. That's what the biofilm formation looks like. And this happened in only 1 month. So fast. And this is what the biofilm looks like under like a microscope, right? It's like this living, growing thing. And we don't want that into our patient's mouth or our own mouths. And so sometimes people say to me, oh my gosh, Amanda, my office is new. We don't have to test this water yet because, the lines are only like a year old. But there was a study by Barbeau that showed that bacteria in dental unit water lines can reach up to 200,000 colony forming units in less than 5 days in brand new lines. 500 colony forming units is what the EPA says is safe water. So 200,000, way more than 500. So that's an epic fail within 5 days in untreated lines. So what is in that biofilm? Well, there's lots of things. There's viruses and fungi and all kinds of microbiota. The three things that we're concerned about, and the three things that have harmed patients, has been Pseudomonas aeruginosa, non-tuberculous mycobacterium, and then the Legionella species. All right, so another little safety game here. My daughter, a year ago, bought a new house. And so I tested the water in her house. So do you think the water in her house is green, good to go, yellow, time to shock, kind of growing, or red, epic fail, she bought a horrible house? What do you guys think?
Yellow.
Did I hear yellow?
Yes.
Yep, okay. You are right. It was a little yellow. And I gotta tell you guys, that shocked me because normally what's coming out of your tap is often very safe because it's treated by the city, it goes through big piping, and it has a really fast flow in your sink. Now, what was happening here was what I encouraged her to do was unscrew the aerator in her sink and scrub it. Because this was an older house and that aerator had been there a long time. And so often that aerator can actually grow the biofilm. So when you get out into private practice, if you were filling your bottles with tap water and you get into a fail cycle, it might be just that aerator on your sink. So that's something to remember. So I mentioned that this harmed patients' health. So we have quite a few instances where that has happened. In Rome, Italy, a woman died of Legionnaires. In Jonesboro, Georgia, we had 35 children that were affected by mycobacterium. In Anaheim, we had between 71 and 202 kids. It depends on who you believe. It's Sweden, a man died from exposure to Legionella from a cup filler. Caracas, Venezuela, 3 patients were harmed by mycobacterium. In Virginia, this one's interesting, this case. In Virginia, where I live, there was a child that was harmed by mycobacterium. But the interesting part about Virginia is this one didn't actually hit the news. And the only reason I know about it is because I live in Virginia. And I actually talked to the lawyers. They asked me for some expert witness testimony around that case. And so there are far more cases than you know about because they often just get settled very quickly. And in fact, in October 31st of 2022, the CDC issued a HAN network alert, which is a big deal. It's the first time they've done this for dentistry. And what they did was they wanted to let the entire public know, hey, this is a real concern. Mycobacteria can grow in the dental unit water lines of your dentist. And this can harm people because there was another outbreak in Georgia. So Georgia has actually had 3 major outbreaks. You heard me mention that Georgia now mandates quarterly testing because, man, they have a big black eye when it comes to water. So just to kind of put a face to this story, as you get out into private practice, and I got to tell you, you're going to be so busy. Like you're going to have wear so many hats. You're going to have so much going on as a dental assistant. You guys are the lifeblood of the office. And so it's easy to let some tasks slide. Like, oh my gosh, I don't have time to do this water thing. So I want you, when you're thinking, okay, I don't have time for this water, I want you to think about Mimi Morales. Mimi Morales is the sweet, sweet little 7-year-old. She is the first one that was affected in that Anaheim outbreak I mentioned, where 71 to 202 kids. I'll explain that difference in a minute. So Mimi Morales is the first child that was sickened by that contaminated water. So what happens is Mimi goes into her dentist and she has a pulpotomy, which is a baby root canal. The next day, Mimi, her face starts to swell. Goes back to the dentist. The dentist prescribes some antibiotics. They go home. Mimi's face continues to swell. So then Mimi's parents take her to her pediatrician. The pediatrician prescribes a different antibiotic. Mimi's face continues to swell. And now she has a fistula forming under her chin. Okay. So they take her to the ER. So the ER was, oh my goodness, this is terrible. She gets wheeled into surgery right away. Mimi spends a month hospitalized. A month hospitalized. Like how often? Like they're trying to get you out of the hospital as fast as possible. She's in the hospital for a month on IV antibiotics, heavy doses of antibiotics. She loses part of her jaw. She loses permanent teeth, and it loses partial hearing in her left ear. So this is a big deal. This isn't just like, oh, you got a cold from this water. Like she is facially disfigured from this contaminated water. So this is the timeline from the Anaheim outbreak. So first Mimi gets sick. She's the first one. She's patient 0, we'll call her. So she spends that month in the hospital. Now, the second kid comes into that hospital about 3 weeks after Mimi, and has this, infection. And by the grace of the universe or whatever you want to call it, the same infectious disease doctor is on duty. And she sees this second kid and she's like, oh, okay, well, whew, we got another, she just treats this kid. Well, then the same doctor is on duty when the third kid comes in. And that doctor, this infectious disease doctor, is like, whoa, okay, this is crazy town. Something's happening. And these kids are without a doubt connected. So she's actually the one that then connects the dots and figures out that all 3 of these children have been to the same dentist. And so then public health comes into this practice, and they totally, they look into this practice. They look into their water lines. Their water lines were off the charts, horrible. And so they track every single kid, every single person that has stepped foot into that practice, and they track them for years to see what's going on. And so, of course, that office is immediately shut down. It hits the news cycle. Everybody wants to make you more afraid of the dentist. They talk about, dentistry's dirty secret of our water lines. And there is still a case ongoing when it comes to this. So some important numbers from Anaheim. So there were, out of the 71, so public health identified 71 children that have been affected by this strain of Mycobacterium abscessus. There are 202 children in the lawsuit. So more were affected, but somehow they didn't meet the public health requirement. So we're going to go with public health. Public health says 71. So out of the 71 kids, 26 of them had to have more than one surgery. 45 of them lost between 1 and 6 permanent teeth. So that's going to mean implants in the future, what's going to happen in the future, right? And 29 of them had to have that antibiotic that I mentioned that Mimi had, the one that they use it for leprosy, and it causes that high frequency hearing loss. So many of them have hearing loss. So we said it was 71 kids. They were between the ages of 2 and 11. 99% of them needed surgery. So almost every single one had to have surgery. Like not just an antibiotic and you're good to go. No, this is serious. But this is the number I want you to remember. And this is the number that I want you to go into your office when you get your first job and they're like, oh, water, it's not a big deal. Not very many people have been harmed by it. This is what I want you to tell them. So those symptoms in those kids, those 71 kids, the symptoms showed up between 1 day after treatment, that was Mimi, and the last kid whose symptoms showed up in those 71 kids, their symptoms showed up at day 409, meaning well over a year after their pulpotomy, then the infection began. Because Mycobacterium loves to sit dormant in our bodies. It loves to hang out in your lungs, and then it waits for that opportune moment for that host response to be able to then affect a patient. So what this number tells me, what this number says to me is that we don't, you can't, many people say, like, let's say I didn't know about water lines for 22 years, right? And so for 22 years, I could say, well, I never harmed anybody, right? I mean, no, all I can say is I don't know. I don't know if I've ever harmed anyone, because it's like that, when you get an upset stomach, and you're like, ooh, was it that Thai food we ordered? Or maybe it's just a flu, or maybe I'm just stressed. Like you don't know the why behind it. I think there's more cases that we just don't know the why behind, because 409 days, how on earth would you figure that out and be like, oh my gosh, they got it from the dentist, right? So this is one of those things that just says, I don't know, but I'm going to make sure that I never harm anyone again. Right. And I'm going to make sure that our water lines are safe. So that's going to be really your job. Now, if you're wondering, like, harm, what does that mean, Amanda? Like, I don't understand. These are pictures from the Venezuela outbreak, and you can see these fistulas that formed. Do you see this? And it was actually eating through their jaw, right? And so this is the seriousness of this infection. So what do all of these US cases have in common? All the ones that I kind of mentioned and many that we don't even know about. None of them were testing their water. So many of them were actually treating their water. They were putting the tablet in or the straw, or they were flushing their lines. They were doing what they thought they were supposed to do, but they weren't testing. And testing is the only way that you will know that your lines are safe. So testing is the key. If you remember nothing else from this lecture, please remember that you must test those lines. And our patients are listening. Our patients, like, they hear about this and they're like, so tell your patients, oh, we just tested our water lines. We're doing great. Use infection control as marketing for your patients. You will not scare patients. You will actually make them feel more comfortable. So that way, if another one hits the news cycle, they can be like, oh my gosh, I know my dentist office tests water. I know they're safe. They look out for me. All right. So have you guys ever heard not to get ice on an airplane? So I tested the ice on a Delta flight. So what do you guys think? Do you think it's green? Do you think it's yellow, or do you think it's red?
Yellow.
Yellow?
Yellow.
Okay.
Red.
Totally green. Good to go. You are good to go for ice on a Delta flight. So I talked about your patient's health. Now this actually affects your health. Dental unit water lines affect you as the clinician. So when COVID happened, all of a sudden we became acutely aware of aerosols. I will tell you, we never thought about, or I never thought about aerosols. Maybe John did, maybe Amanda did, but I did not. And so like when we came back post-COVID, like I felt like I was swimming back into the office, like going through the dandelion wishes of aerosols, right? And so we were really concerned. We were convinced that we were all going to get sick. Well, 3 studies have come out, and I'm sure there's more coming, that really have confirmed that truthfully, we are not aerosolizing patient saliva. There's this awesome study, the middle study that's on that list, came from the Ohio State University. And what they found was they captured the aerosols and they figured out what was in the aerosols that we're breathing all day long. And they figured out that 78% of those aerosols were traced directly back to procedural water, to the water we're squirting in patients' mouth. This is what you are breathing. The other 22% came from ambient air. 0% came from saliva. We're not aerosolizing saliva like we thought. We're aerosolizing our procedural water. So what are you breathing? Is that procedural water safe for you and your dentist and your hygienist and your front desk and every single person that walks into your practice? Is it safe to breathe? And we know that there are some studies that show that dental healthcare professionals have the highest prevalence for Legionella antibodies because it comes from dental unit water. And exposure to contaminated procedural water may lead to the exacerbation of asthma and other respiratory conditions. And then they redid the Legionella study because somebody tried to debunk it, and they found, nope, it is definitely a risk from water lines. But it's not going to be a risk for you because you're going to know how to take care of your water lines. You're going to come into that practice and you're going to be a waterline warrior, and you're going to be like, I'm going to keep us safe. I'm going to test our water and I'm going to treat our water. And I mentioned a whole slew of organizations say that we have to do this. So even if you're just not into patient safety or your safety, you got to do it for compliance. So what does the CDC have to say about water? The CDC says that the procedural water that you use for your patients, non-surgical water, surgery is a different story, non-surgical water must be less than 500 colony-forming units of heterotrophic bacteria. But after that, the CDC doesn't say much. They just say, talk to your manufacturer, follow recommendations. So we need to figure out, how do we get there? And that's what we're going to talk about. All right, another safety game. Ice on a Southwest flight. What do you think? Red, yellow, green. How do you feel about Southwest?
It's all green because it's all bad rice.
I couldn't hear. What was the answer?
Green. It's all
Green? Okay, I heard green, that we have faith in Southwest. Southwest actually came out as a yellow. So maybe consider no ice on Southwest. Just saying. All right, so how are we going to keep our water lines below 500 colony forming units? We're going to do a system of shock, test, treat, and maintain. So shocking is using a strong disinfectant. Testing is verifying that your lines are in compliance. Treating is a low-level antimicrobial, and maintaining is having a system in place. The first thing when you walk in that office that you have to figure out is, where is the water coming from? Is it coming directly from the city? Is it coming from the city and going through a centralized water system and then to your chair? The big thing I want you to figure out is that central water license, like there might be a system, a filter system, is that actually treating your lines? Sometimes people think that they have a system in place, but it's actually just removing the minerals from the water. It's not actually treating the water. So as you test your lines, if they're like, no, we have a filtration system, and you're like, but we fail, it might be because that centralized system is not actually treating lines. The CDC, the ADA, and the Association for Dental Safety all recommend independent bottle systems, a closed system. You have a much more control over your water system. So it's really encouraged that offices retrofit, if their chair doesn't have a bottle, to have a bottle added. It's pretty easy to do. It has a pretty low upfront cost. It provides you with that ability to pick a water source. You can continue to work during a boil water advisory, which does happen. It's happened 3 times in our state in the last 6 months. Huge, like week-long boil water advisories. You have a wide variety of products you can use, so you have more control over your program. The only con really is, well, I guess there's a couple cons. I mean, it's something else you have to do, where a centralized system kind of takes the work away, but they fail more often. The one pain in the butt is when you run out of water in the middle of a procedure. I will tell you, you're like, darn it. So that's that really one downside, but it outweighs the other ones. So what are you going to fill your water bottle with? You have a lot of choices. You can use spring water. You can use tap water. You can use distilled water. You can use sterile water. You can boil water. There's lots of choices out there. The big thing is you want to make sure that whatever source water you choose, that it's safe, right? That it's hopefully you do a test and you get no growth. You get, it's a green. You want to start off with a green. Now, one thing to look at is a lot of people use distilled water, and there are now chair manufacturers, both ADEC and Midwest, they're big chair manufacturers, are saying don't use distilled water because that can be corrosive to some brass fittings within the chair. So make sure you follow the instructions for use of the chair if it has a preference for what type of water to use. My office, we use tap water. We have great tap water here in Norfolk, Virginia, and that's just what we use. And darn it, it's free. It's one less thing. So shocking, that strong disinfectant. So you want to shock before the initial use of a Waterline product. Like if you walk into an office and they're like, we've never done anything with their water, you got to shock. You're going to figure out a system to shock periodically. My office, we shock quarterly. And then you want to shock if your water level contamination, if you do a test and you are in that yellow zone, you definitely want to shock. You don't want to wait till you fail. It's like a cavity, right? If you had a little cavity, you're going to take care of it and you're going to do a little filling. You're not going to wait until an occlusal turns into an MOD. You're going to take care of an occlusal. It's the same thing. You're taking care of it before it fails. There's lots of shock products on the market. There's Liquid Ultra, ICX Renew, and Bleach. Those are your strongest shock products. Citrasil and Monarch, and actually you can't even get that hypochlorous one anymore. I need to take that off, sorry. But Citrasil and Monarch are much weaker shocks. So if you're failing, they're not going to be strong enough for you. You really want to then grab a Liquid Ultra, ICX Renew, or a Bleach. It is super important that you read the instructions for whatever shock product you choose, because they only work if you do what they say. You can either be too weak and not actually kill the biofilm, or you can destroy your chair if you do it the wrong way. So how do you shock? First thing you want to do is you want to turn off your chair and you want to air flush the lines, meaning like you push the air water syringe and go shh, and kind of let the little spurt of water and a little spurt of air come out. Then choose whatever solution you're going to do and read the instructions. Mix the product. Sometimes it's 2 bottles. If you're using bleach, it's going to be a dilution. It depending on what percentage you pick, it might be a 1:9 or a 1:13. And so add that into your bottle. Then reattach your bottle and then run that shock into each and every line that can get water. Even If you don't use that line, in fact, especially if you don't use that line, because that's what we call a dead leg. That's a line where, I mean, the biofilm rave is happening in that line because the water just gets to sit stagnant. It's like super swampy in there. The power scaler will take forever. And if anything is going to fail, it's the power scaler that fails the most. It has the longest line and it has the lowest water flow. So it will take a while, but just get that shock through there. I really like it when I use a colored shock because I can see it come out the other end and I know for sure that it's getting shock. Sometimes you'll find that you have a line where you think it's connected to the bottle and then you'll realize it's not connected to the bottle. Like one weird random line for some reason is coming straight from the city. And then it keeps failing. And you're like, well, no wonder it's failing because it's not coming from the bottle. At that point, I would recommend that you do an inline filter just for that line. So you're going to leave that shock in for the recommended amount of time. Bleach is 10 minutes. Liquid Ultra and ICX Renewer overnight. More is not better. So you're like, well, she said 10 minutes for bleach is good, so we should leave it in for 5 days. No, you're going to wreck your chair. So 10 to 15 minutes tops for bleach and then flush it out. Liquid Ultra overnight, flush it out. If it is an overnight shock, I recommend that you put a shock in progress sign on the chair just in case, I don't know, what if you're sick the next day or heck, what if you forget, right? And then you're squirting shock into a patient's mouth and they're like, this water tastes funny. We don't want that, right? So you can disconnect the bottle and dump the rest of the shock that you didn't push through into the sink or just run it all through. I really like running it all through, truthfully. Refill the bottles with some warm water and flush 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 till the cows come home. That's really pushing that biofilm out there. If you do use bleach, do not put your bleach into the suction lines. Like don't run it down your HVE because it's handy. That can affect your amalgam separator and that's not good. So I always make sure I have a bucket with me so that way it's handy. I'm not stretching the lines trying to get to the sink. So this is what it looks like when I go to test my lines. I bring a bucket, I bring a bottle of bleach, I bring a measuring cup because I do not like to do math. And so I do 1 cup of bleach and then I do 9 cups of water. Then I don't have to do math. I only have to count to 9. It's much easier. And then I also bring a dummy straw. A dummy straw is something that you might need if your office is using an uptake, if your office is using a treatment straw. And we'll talk about that in a second, but I know I'm getting ahead of myself. But if your office is using one of these treatment straws to treat your lines, you typically don't want to shock through that line. The reason that is because the shock can mess up that active ingredient. So you will twist that off and then you will simply twist on a dummy straw. And then you'll twist it back off again and you'll put your treatment straw back on. So don't shock through that unless the straw and the shock are compatible. Super important. So now you want to test. So you've shocked. Now we want to test. So there is in-office testing, there is mail-in testing, but the only way to know if you're doing it right is to test. It's the only way to prove it. If ever somebody were to come in and inspect your office, they're going to ask to see your waterline testing logs. Now, the test needs to be a test for dental unit water lines. There are some water tests at the hardware store that you can buy. And I went and looked at them because somebody told me that's where they were buying their tests. It either is testing for total dissolved solids, which means that's the minerals that are in your water, which that's the stuff that like gets on your coffee pot, and that's why you got to clean your Keurig with, some vinegar. That's not what we're testing for. Or there's tests that test for total coliform bacteria. And you might be like, oh, total, that sounds good. I like total. That's only testing for poop. It's E. coli. That is the only thing it's testing for. Now, we do not want E. coli in the lines, without a doubt. However, we are testing for more than simply E. coli. So do not get your test from the hardware store. You have to get a test that is intended for dental unit water lines. Okay, so when do we test? So you want to test kind of at the, the beginning of your journey. If you enter an office and they have no waterline protocol, maybe you start with testing so that you show them, this is why we need a waterline protocol. Look, we're in an epic fail. We got to take care of this. You also want to test before you make any changes because you want to understand, are you in the yellow? Are you in the green? Are you in the red? Because that will tell you what you need to do, how much you need to shock. Do you need to use that really strong shock that I talked about? Then you should test routinely, whether that is check your manufacturer's instructions for use for your chair, because it might tell you. But if it doesn't say anything, you want to test monthly for 2 consecutive passes and then move to a quarterly shock. And you want to test before you shock. Don't shock and then test, because that might be a false pass. I want you to test first and then shock. Then you'll know, okay, our lines are really good. They're green. Oh, our lines are yellow. It's, oh, we definitely need to make sure we're using a good shock product. Or, our lines are red. Ooh, we got to do a big shock, right? And then you always, of course, are going to test after a fail to make sure you're passing and make sure it's safe. But again, I don't want you to shock or test right away after a shock, because I want you to make sure that it's a really good one. So I recommend waiting 3 to 5 days. Collecting your sample is super easy, but read the instructions for your test. Some of these tests, some of these chairside tests have like 12 to 15 steps. So you need to make sure that you do them all. They're like drop 3 drops. And if you drop 4, you've negated the test. So make sure that you read the instructions and you're doing the test right. And you're doing it in an aseptic way, making sure you have gloves on. You're not contaminating the sample. It's super important. You can do a pooled sample. And this is great because this means that you can do per operatory, per water source, you can do 1 test per operatory, not 1 test per office, but 1 test per operatory. It's going to save you some money. So the idea is that then you figure out how many water lines you have and you take equal amounts of all the water lines. And then if you pass, you pass. If you fail, you're going to shock all the lines anyway. The only time I do individual line testing is if we're in a big fail and I'm like, darn it all, who is the culprit here? It's typically the scaler. It's, it's just a problem. So some pro tips for getting a good sample. First, you walk into that op and figure out how many lines you have. So you have an air water syringe, you have an assistant air water syringe, you have a handpiece line, maybe you have a power scaler, maybe you have an air polisher, maybe you have 5. So we're going to do a fifth, a fifth, a fifth, a fifth, a fifth, and a fifth. I think that was 5. So decide whether you're doing a pooled sample or individual sample. Wash your hands, put on your gloves because we don't want to contaminate our sample. Remove any devices, handpiece, air water syringe. We want to really get to that source water. And then flush all the lines for 30 seconds because that's what you're going to do for a patient anyway, right? We're going to flush those lines. So flush the lines for 30 seconds. If you are getting a sample from an air-driven handpiece, that's the thing that you'll put the drill on. If you are getting a sample from that, take that one first because it blows air at the same time and it kind of makes a mess. It will blow out your entire sample if you do the other lines first. So do the handpiece line first. So there's in-office testing. The nice thing about in-office testing is it's total confidential. You get to fail in private. When I started my Waterline journey, we failed bad. We failed so bad. And it was kind of nice just to fail in private, right? You do, though, get an imprecise colony forming unit count, like you're seeing on those paddles. So you don't get an exact number. But it's more economical. And since the Association for Dental Safety recommends that higher frequency, that monthly than quarterly testing, this is a great affordable way to do it. And you get your results in 15 minutes to 7 days, depending on which test that you choose. So these are some different examples of some in-office test kits. Mail-in testing. Mail-in testing is great third-party verification. So somebody else has said, yep, your water lines are passing. I highly, highly recommend that once a year, at minimum, you do a mail-in test. That's what we do in my office. Every January, we do a mail-in test. And so that's somebody else saying, oh, yep, your line's passed. And it's far more precise results. And so where some of these other tests, the chairside tests, some of them might, just give you an idea of what's going on. Now you'll actually know. It does require overnight shipping, so it's more expensive, but you get a report emailed to you that you can keep on a dashboard or in a file, and you get those results in 1 to 7 days, depending on which test you choose. So these are all the tests here. These are a bunch of tests that use an R2A, which is kind of our gold standard for testing methods, and you get those results in 5 to 7 days. There is a new test on the market called flow cytometry, and it uses lasers and fluorescence, and it's actually it counts all of the bacteria, living and dead and damaged. It's super cool. This will become the standard of care, but we need some more studies. But this is totally good to use, and you get your results in 1 day, which is really nice. Now, what do you do if you fail? The first thing that I would recommend is that you shock 3 times. Do it, I call it a triple shock with a strong shock product, that Liquid Ultra, that ICX Renew, or that bleach. And so I think that with that shock, with that triple shock, you take off that protective layer of biofilm, the virulent layer of biofilm, and that dead damaged layer of biofilm. Also, try another shock product. Maybe you're using one of those weaker shocks, right? And you need to use that stronger shock. check for dead legs. Is there that line that you don't use? Maybe it's a hygiene room that's failing and it's set up so that it can have a dentist handpiece in it, but you guys don't use it, and so that line is just sitting stagnant and swampy. If you have one of those, either have your service tech cap it off at the source because you're not going to use it, or that line has to be run every day and in between patients just to keep that biofilm from getting stagnant. Then I mentioned checking your source water when I was talking about my daughter Madeline's house, how that sink was a little questionable. Check your source water. If you're filling it from an in-office distiller, sometimes those really get mucky and failing if you're not taking care of those. Or it could be that aerator. So see if maybe that's where the failure's coming in. And then also check your filters. When I started my Waterline journey, I had a scaler that had a filter that looked like this. And I knew nothing about it. It was kind of behind the cabinet and I never knew it was there. Well, oh my goodness, mine was black. And you're actually supposed to change that thing regularly. Well, no wonder I had biofilm shooting out of my scaler because it was living in that filter and just coming through. So check some filters. You could even have a filter in the junction box. And so maybe there's something going on there. But one thing I want you to be really cognizant of, and as I'm telling you this green, yellow, red, testing is, you want to be able to catch a fail before it's a fail. You want to catch it in that yellow. And so some of the tests on the market are pass-fail tests, and you really miss an important piece of data with that pass-fail test. You miss what I like to call it the creep. The yellow is like when it's creeping, the biofilm's coming, right? And that's when I want to know. I want to know, oh my goodness, something's happening. And so I really encourage you to use some of these tests that let you know that the biofilm is coming and not a pass-fail test. So, okay, safety game again. ICE on United. So we talked about Delta was safe. Southwest was questionable. What do you guys think about United?
Yellow.
Yellow? Okay. Green. Totally safe. United is good to go. All right, so we talked about shocking. We talked about testing. Now it's time to treat. I want you to treat yourself because you're passing. You're like, woohoo, I want you to have a little party. And then also start treating your lines. Now, the reason that you want to shock and you want to treat is because shocking is like when you go into the dental hygienist, you come and see me, right? And I am doing my darndest to get all of the biofilm out of your mouth, right? I am disrupting that biofilm in between your teeth, under your gums, all of those places that, maybe you're missing. Like this is a picture of my dad in for his hygiene visit, right? And I'm working hard on my dad. I want to make sure my dad is as healthy as he can be. But I would never say to my dad, yo, Dad, I am so good at disrupting biofilm that you don't have to brush or floss or use your water pick or use your perio protect trays. You don't have to do any of that. No, I never say that. I tell my dad to do his home care. Home care is treating. Home care is keeping that biofilm at a manageable level. So again, I talked about those centralized systems. So there are those centralized systems that do offer kind of a treatment product. First, they'll come through with a shock, and then they sort of treat the lines as it goes through. But just because there's a system there doesn't mean that it's doing that. So make sure you check that. But if you have a bottle, you can use a tablet, which is super easy. The big thing you want to figure out is how big's your bottle, the size of the bottle and the dilution factor. You're going to put the tablet in the bottle. You're going to fill it up with water and then let that tablet effervesce, meaning, let it like fizz, kind of like when you're dyeing Easter eggs, right? You want to let it fizz. Before you screw it on, because if you do it if you just screw it on right away, it will sit like a stone at the bottom of the bottle. And you want to make sure that it doesn't do that. Okay. So sometimes if I'm in a big hurry, sometimes I will crush the tablet and put it in and then shake it up so that it'll dissolve fast. One thing we figured out in my practice is that our bottles were all different sizes. And so some we were over diluting, like this was a big bottle, right? And we were like filling it up to the tippy top. So we were over diluting it. So we weren't getting the proper antimicrobial benefit. So if you find that, check your bottles and make sure that they're all the same size. You can also do your tablet water in a big gallon jug and you could top off all of your bottles. Depending on which tablet you choose, that active ingredient is good for 14 to 28 days. So read those instructions for use. You can mix it however you want to mix it, but make sure you're mixing it with that proper dilution. So these are a bunch of different tablets that are on the market. They're all great. Straws and cartridges. I showed you that straw, that treatment straw when I was talking about the dummy straw. Now, some really well-meaning service reps came on the market and they came out to offices and they're like, oh, you put this straw on and you don't have to do anything for a year with your water. It'll take care of it. Dude, straws are not a get out of jail free card. Okay, straws are designed to last, depending on the straw, some are 6 months and some are 1 year. But the 1 year ones are designed for 1 year or 240 liters with really good quality water. Well, first off, who knows when you go through 240 liters? I certainly don't count how many times I fill my bottle. But secondly, if your water isn't pristine and really good quality, you could be using up like all the antimicrobial agent just trying to deal with your source water, and so it's going to fail sooner. So no matter what, make sure you are testing your straw. We said at minimum quarterly. So these are the 1 year straws that are on the market. ProEdge does have a 6 month straw. So instead of waiting a year, because a year is a long time, they were finding through their testing that straws were starting to fail around the 7 or 8 month mark because they was just running out of active ingredients. So that's why they did a 6 month straw. So it kind of has its own little hygiene recall. Now remember, if you're using a treatment straw, before you shock, you might want to switch out to a dummy straw. ProEdge will mail you a dummy straw for free. So they're a good company to have a relationship with when you get out in the field. There's also liquids that are on the market for treatment. They vary greatly in their instructions for use, so make sure you read those instructions. Some are daily, some are like over the weekend, some are like 10 days, and then you switch to weekends. So make sure you understand how to use it. And these are a few of those that are on the market. All right, so safety game again. So this is toilet water at a hotel. I actually checked into a hotel and I leaned in and I got the toilet from the bowl. I got it from the bowl. So what do you think? You think red, yellow, or green? Red?
Yellow.
Okay. It's totally green. And the reason that it's green, I want you to think about it. When we talked about why biofilms form in dental unit water, tiny tubing, low flow. Think about how long it would take to fill a cup of water with your air water syringe. Like you would stand there for a long time. Where a toilet, it is fast. It's a flush, right? I mean, literally, shush, this flush of water. So it really almost self-cleans. Now, please do not fill your water bottle from the toilet. I'm not suggesting this by any means. But that water actually, the toilet water is actually cleaner than your dental unit water lines. Whoa, that's crazy. All right, so we talked about shocking, testing, and treating. And now you want to have a system. You want to maintain those lines. You want to keep yourself in passing. The biggest thing is, appoint a waterline warrior in your practice. It will probably be you. Often it is the dental assistant that gets this role. So make sure you establish some standard operating procedures. What are we going to do? What products are we going to use? How often are we going to test? Are we going to do a mail-in test once a year and quarterly test? What are we going to do if we shock? You want all of that in writing. And no matter what, every time you test, you must keep records of what you're doing. You will learn very quickly in dentistry, if you didn't write it down, it didn't happen. You must be able to prove that you have safe water. God forbid someone gets sick. Now you can be like, nope, not our lines. Like, must have come from something else because we've been testing and treating our lines. So flushing versus purging. Once upon a time, we used to always like turn off our units at the end of the day and air flush them, try to get all the air and water out. So it's now recommended with many of the treatment products that instead of purging your lines at the end of the day, instead of getting everything out, is actually to leave treated water in the lines overnight and over the weekends. Really, we're only going to purge our lines or turn it off and try to get the air and water out if you're gone for an extended amount of time, maybe 1 to 2 weeks. And if you're gone for 2 weeks, I actually want you to shock your lines before you reopen because 2 weeks is a long time. The biofilm has had a party while you were, off on vacation. I do, though, want you to flush your lines every morning. So you walk into the office, you start the day, you're going to flush every single line for 20 to 30 seconds. And sometimes there's actually like a button on the chair that does it for you. But flush the lines for 20 to 30 seconds in the morning and then 20 to 30 seconds between patients. There is some suck back, some retraction that can happen from one patient to the next patient in our water lines. We don't understand why, but it happens. So we really want to make sure that we're not sharing one patient's germs to another patient. So some myths that I always hear when I talk about water lines is we use distilled water. So you'll hear this. One of you, I guarantee, will end up in an office where they're like, no, we use distilled water. We don't have to do this. I hope I have imparted upon you. It has way less to do with what water you start with. And it has way more to do with the engineering of your chair, those tiny water lines, and that's where the biofilm forms. Distilled water is not a get out of jail free card. It is not safer. And in fact, distilled water might be contraindicated for your chair, and distilled water has no chlorine. So it actually might grow more biofilm. Then I guarantee one of you will end up in a practice where they're like, oh, the city water. It's just we can't do any of this because we just have city water. It just comes from the city. And really what has to happen is either they have to retrofit their chairs with bottles or they have to install a centralized system. So they must make a change in order to start treating their water. Now, all of the water that we have talked about has been for non-surgical procedures. If any surgery is happening in your practice, you now must use sterile water with sterile tubing. You cannot pour sterile water into your bottle and think it's going to be sterile when it comes out. Remember, the biofilm happens in the lines. So you must be using a device that's designed for delivering sterile fluids, or you can have a little syringe like that that's meant for sterile fluids in a sterile dish. Because we need to make sure that we are not introducing anything into an open field. Now, what is a definition of a sterile procedure? That can be an incision, excision, anything that exposes normally sterile areas of the oral cavity. That would be a biopsy, periosurgery, apical surgery, implant surgery, implants. Many dentists, general dentists, are doing implants now, and they don't know this, that they have to use sterile water. Any surgical extractions, endodontics, and without a doubt, pulpotomies, those baby root canals. We saw that in that Anaheim case, right? They weren't using sterile water. They'd use sterile water. None of those kids would have gotten sick. So, do I really have to test? Hopefully you're like, yes, we have to test. That's the most important thing we learned today. The CDC, the Association for Dental Safety, the FDA, you have to do this. This is something we need to do. John Molinari and Nancy Dewhurst did this really great study where they found that nearly 1/3 of treated water lines still fail to meet CDC standards. So people that are doing the right thing, they think they're putting in the tablets, they have the straw, they're shocking their lines, they think they're doing the right thing. 1/3 still fail. I still fail. It happens. This is why you test. Non-treated lines, if you're not doing anything, they're likely to have 200 to 400 times greater the CDC recommendations. And 61% of practices have at least one failed line that test. These are the ones that are testing. Think about the ones that aren't testing. And testing is the only way to know if your protocol is working. And testing's kind of fun, right? It's a fun little game. Be like, am I going to pass? So what do you have to do again? You need to shock your lines with that strong disinfectant, test and document it. If you're using in-office tests, take a picture of those tests. I always take a picture of it. Choose a maintenance product and use it properly. Flush your lines at the beginning of the day and in between patients. Retest quarterly at minimum and document that. And then shock as needed. Again, I told you, our office, we shock quarterly. All right, one more safety game. So I travel a lot, almost every week. And I often fill my water bottle at the one of those water fillers, you know? What do you think? Are those good? Are those green, yellow, or red?
Red.
Red? Okay, I've tested a ton of them, and I gotta tell you, they are all green. Think about how quickly it fills your bottle. It goes pretty fast. Even like this one's gross. This one's like mucky at the bottom and yucky and water's totally safe. And I probably have tested like 50 of these. They have all passed. So you're good. You can be hydrated. So this is a picture of my Waterline protocol. Guys, when you get out into private practice, I encourage you to keep my email. I'll show you that in 2 slides. If you want to see what an example Waterline protocol is, I'm more than happy to give it to you. Is this the best one out there? I don't know. It's just the one that works for us. These are my references. So if at some point you want, like you enter an office and they're like, well, let me see, is that true? You can be like, oh yeah, hang on. I can get you some references. I'd be happy to share those with you. And then this is my contact information. So I'm sure that John and Amanda will share this with you. If you guys need this in the future, I'm more than happy to help you guys become Waterline warriors with me because, you know, we need more Waterline warriors out there. And then I mentioned that I work with ProEdge Dental Water Labs, and they are super generous with tests and giving tests, especially to students, because you guys are learning. So if you guys want to use this QR code or you want to copy down this URL, you guys can get a free test. And so I imagine you guys go out on externships. When you do that, you can go and test the lines and be like, oh, excuse me, your lines are failing. Let's talk about your waterline protocol. So feel free to grab one of those, or John and Amanda, if it's easier, I can always have tests sent to you if that's an easier system for your classes, if you'd rather that.
That'd be amazing.
Okay, yeah, just shoot me an email with like the number of students for each time and then an address, and I'll just have ProEd send you some tests.
Okay, great.
Do we have any questions?
Of course, Amanda, instructor, has a question. I'm one of those people that every single time someone says, "Does someone have a question?" It's always me.
I love it.
So when you say offices need to have a log of those tests,
yeah,
if there is an inspection of a dental practice, which we know is very unregulated, what is the fine behind those offices? Are you aware of? Is there a fine involved, or do they give them a period of time to do a test, even if they've been open for 20, 30, 40 years?
It 100% depends on the state and the inspector. It's sort of like, what is the fine if I get caught for speeding? Well, did I manage to talk myself out of it or not? Right? So it really depends, but it can be thousands of dollars. And I will tell you the settlements for the people that have harmed patients are in the millions.
Oh, I would think so, yeah.
So it's just one of those risks that you're like, am I willing to chance this one?
Right.
And I'm excited that now that we have 2 states that now are really working harder to regulate dental unit water lines. So Georgia now has 2 inspectors on their board that are literally walking into offices asking to see their water logs.
That's great.
Yeah, which is fun. I kind of want that job, don't you?
Yeah. Oh, yeah. I know. I don't say it, but I love to catch someone in the act of not doing something that they're supposed to be doing.
Right? Yes, except for speeding, because I might do that.
We have another question, Ms. Jennifer.
Is that an OSHA violation?
Oh, this is a good question. Okay, this is exciting. So if you had asked me this question like 6 months ago, I'd have been like, no, OSHA doesn't say anything about water lines. But in Arizona, just 2 months ago, OSHA came in and fined an office under general duty clause because of the risk to the employees. So we now have 1 case that I know of. There might be more because I don't know everything. But we specifically know that OSHA has now used the general duty clause to fine an office.
Huh.
So I don't know the fine yet because it hasn't become public yet. So I'm waiting to see the fine. So you won't find that. Like, you can't find it right now. I only know it because I know the compliance person. Like, they had to hire a compliance person to fix all their junk. I mean, they had way more than just water, but they got fined for that.
Yeah, and that's typically what we see, that if someone's not testing water lines, they're not.
Yeah.
I mean, the list is,
Oh, it's so bad. It's so bad.
I think that from our perspective, that if offices are following a good hand set of rules, then commonly, they're fairly compliant with not everything. But
right,
when you're walking into those offices and they're like, oh, they don't run suction to the end of the day. I never see trap changed. I don't.
Spore testing? We're supposed to test our autoclave? What?
Oh yeah, I just was in an office like that 2 weeks ago. Yeah, they're not testing the autoclave. So, it's just that ripple of I'm just literally coming in and doing dentistry and leaving at the end of the day.
Right.
So.
Right.
Okay. Any other questions? We'll try to get everybody a test. Maybe not your air water syringe on first day of externship, so you don't get quote unquote be like, please do not return.
I know, right? Okay, yeah. Listen to your instructors. I know I'm a little fanatical about it, but do what they say. But
we'll secretively do it, and then we'll handle it from there.
Yeah, but spread the word about water. You can certainly say, what's your waterline protocol? And when they say what, you don't have to be like, dude, you need one, but you can be like, oh, okay, interesting.
We're always encouraging that what the rules are technically.
Yeah.
Might not know everything, but a couple months in, how can we progressively get it to the better way. So
Absolutely. Absolutely. And I always, I encourage people, I speak on total infection control too. And I always say, like, okay, start with what's going to kill people. Like, start with the big stuff, like definitely water lines, definitely spore testing those autoclaves. Like, start with the really big stuff and then work your way around.
yeah, absolutely. Absolutely. But thank you for your time. Of course, as always, we love all the information, and have a good trip. I know John and I are going to be contacting you because we're going to be taking that infection control class. So
I'm excited.
I'm nervous for that stinking test.
You got it. I was so scared, but you guys can do it. You guys can do it. And then hopefully your students will also then learn all about getting a CDIPC. I guess I didn't even talk about that. I'm certified in infection prevention and control through Danby Dale and the Association for Dental Safety. So that's a whole nother, certification you can get that just kind of says you know your stuff when it comes to infection control.
Yeah, absolutely. So John and I are headed that direction.
Yay! I love it.
Fingers crossed. So, all right, John, anything else?
No, that's all, Amanda. Thank you so
Okay.
much. Stop the recording for now, and then we'll follow up
Thank
with
you,
you with
Amanda.
anything else.
Thank you.
Okay. Thanks so much, guys. Have a great day.
You too.